My name is Sandro Galea. I serve as Dean of the WashU School of Public Health. Welcome to Public Health Ideas. These are conversations that aim to highlight work that advances the science of health. This, in particular, is a series of conversations we are having about current changes to the policy landscape. The goal is to have nonpartisan, science-based conversations, to keep an open mind about potential policy change, even to welcome potential change for the better, but to be analytic about how the proposed changes may affect the health of populations. Today, I have the privilege of speaking with Professor Matt Kreuter. Professor Kreuter is the Kahn Family Professor of Public Health at the WashU School of Public Health. He's a leading expert in the field of public health communication. Matt, welcome.
Glad to be here.
Today, we're going to discuss how the deprioritization of public health funding may weaken pandemic preparedness. We're also going to discuss the messaging that can spread vaccine skepticism, affecting uptake and public trust in health guidance. So, Matt, let's start with the current public health funding landscape. Talk us through how you view the cuts and consolidation we are seeing.
Okay, so let's start with the cuts. So many areas of public health are being, we're seeing fewer resources devoted to them. Global health, climate change, HIV/AIDS, worker safety and workplace safety, vaccines would be, I think, high on that list. And then there have also been cuts to programs that aim to improve health equity, or what we think of as the gaps in health outcomes that exist between different populations. And then there have also been cuts to programs that aim to improve the health of specific population subgroups, like LGBTQ individuals, some racial and ethnic minority groups, and immigrants. And then in my field of health communication, we've also seen recently that the communication infrastructure of many federal agencies like CDC and NIH and FDA have also been cut back, or in some cases eliminated, which makes the function of communicating health information to the public a bit more challenging. And so in the specific context of a pandemic and pandemic response, especially global health, vaccines, communication, those are all things that you would think are going to make it, a bit more challenging. In terms of the priorities that are emerging, and I think we're starting to get a clearer picture of this with the Make America Healthy Again agenda, it looks like some of those priorities are going to include a safer and healthier food supply, so better nutrition and healthy eating for Americans, trying to prevent chronic diseases, especially among younger Americans, toxic chemicals, reducing kind of toxins in the environment, and then also device use among young people, all of which are, I think, important and worthy health priorities, and we'll see sort of what the specifics are as the weeks move forward.
Let's talk about pandemic preparedness for a second. So, what are the key actions that the administration has taken that affect pandemic preparedness, and what do you think about that? How is it? What should be done, and how is it different than what should be done?
So, in responding to a pandemic, one of the things that you need most is kind of a centralized, authoritative source of reliable information for the public. I mean, there are a lot of people who want and need to know what to do, whether that's the public or whether that's doctors and healthcare providers, or whether it's local leaders. And I think right now it's unclear where that is going to come from. Like, what will be the authoritative source of recommendations and guidelines in a crisis situation? And so that still, I think, has to be sorted out.
Take us back to COVID, because a lot of what's happening now goes back to COVID, for better or for worse. How would you grade how we did in terms of communication as a country during COVID, and what are the implications of that grade?
Yeah. So let's start with this. It was immensely challenging. And it was immensely challenging because the pandemic itself was evolving so quickly. The science was changing weekly at times. And so many different groups needed different kinds of information. The public needed certain kinds of information. Businesses needed to know what to do. Schools needed to know what to do. And so you had to respond to all of those really simultaneously, and against a backdrop of kind of growing misinformation where people were making false claims about the pandemic and about responses to it. So it's challenging. So that being said, we made a lot of mistakes. And the three that stand out to me as sort of the ones that we ought to pay a lot of attention to. The first one is the most fundamental part of communication, and it's listening. Like, you can't have effective communication without listening. And I think we didn't do a good enough job of listening to, and maybe more importantly, taking seriously the perspectives of people who thought differently than we did. And I think one example of that is, think about all of the parents who were really opposed to closing schools. And for the most part, they were dismissed as being sort of reckless. And yet, when you look back now, I think it's hard to argue anything but they were right, and that the cost of closing schools was really quite severe for a lot of kids. Second thing that I think we did wrong or did inadequately is, I don't think we did a good enough job of explaining some of the complexity of science and even vaccination to the public. And I'll give another example here. People believed that if they got vaccinated, if they took the COVID vaccine, that they wouldn't get COVID. Now, that's not really how the vaccine worked, but it's a reasonable interpretation for a person who's not a scientist, not a doctor, not an immunologist. And then people would get the vaccine and they'd get COVID. And they would conclude from that, this doesn't work. Like, why am I doing this? Why did I take this if I get it? So it's not an accurate scientific sort of response, but it's a reasonable response for people. And then they conclude that it's not worth it and they don't trust it. All of that because I think we didn't explain well enough how things work, and we didn't set people's expectations. And then the third thing I think we did poorly that is related to that is, I think that our orientation for at least the first few years of the pandemic was to promote vaccination as opposed to helping build public understanding of vaccines. And I think there's an important difference there. And I think we'd probably like a do-over there. We did do some things right. I think we did a good job of building partnerships to get information out faster to more people. A new term emerged during the pandemic, trusted local messengers. I think we did a good job of identifying who those people were and mobilizing them to help their communities. I think journalists did a pretty good job reporting on the health and economic consequences of the pandemic in ways that actually led to some policy changes. And I think over time, we got better at addressing misinformation.
Let's build on that. So let's talk about vaccine skepticism. There's a lot of conversation about it. If you were to break it down, just for those of us who are not expert in the field, what are the key drivers of what's going on right now with vaccine skepticism?
So I'm not a huge fan of the term vaccine skepticism because I don't think it applies universally. I think the way people view the flu vaccine is quite different than the way they view the COVID vaccine. And people who have sort of objections to the COVID vaccine, those objections are often quite different than the objections people have to children's vaccines. So I don't think it's kind of a uniform phenomenon. But as it relates to the COVID vaccine, in Missouri, if you went to local health departments, and I've had these conversations with them, they will tell you that the folks, the rural populations that they serve are really very adamantly opposed to the COVID vaccines, to the point that they often don't even offer them or talk about them because the reaction is so strong. For the people who hate the COVID vaccine, I think it's really more symbolic and kind of ideological. And it isn't a hatred of vaccines or medicine per se. No. What it's come to symbolize is outside experts came and told me to do this, and they didn't listen to what I said, and in my opinion, they turned out to be wrong. Therefore, it symbolizes all of that. So I think that's a different set of challenges than we see for other vaccines. Now, The bigger challenge for all of public health that's not unique to COVID is that those opinions get hardened and set because we now, most of us live in these information bubbles, these echo chambers, where all of our information comes from people who think like us and believe the same things that we do, and we don't get different sorts of perspectives. And that's an immense challenge for health communication, because how do you have meaningful conversations about complex information if people are existing in these different information universes? So my favorite story about this is I have a colleague, Rachel Garg, who talks to her dad every week, and they see the world very differently. And she always starts by saying, "This is what's going on in my universe, in my information bubble. What's going on in yours?" And I think we need to figure out how to do that on a population level.
I like that. Let's talk about, you mentioned earlier the word do-over. You said in some things we want to do a do-over. Let's take an ideal world. New pandemic tomorrow, one that spreads respiratory virus like COVID-19. Ideally, what's an ideal scenario? How would government and public health address it? How would we learn from what happened in 2020, 2021 and do it right this time? What would that look like?
Yeah, so I mean, I think there's some things that don't change. Like there's some of the scientific response, kind of the blocking and tackling of a pandemic that, what's the agent and how's it spreading and how can we prevent it and treat it? But in terms of like how we would apply lessons learned, I think a big one would be that during COVID, we made decisions as if health was the most important consequence, and in many cases, the only consequence, and prioritize that above everything else. But that came at a high cost. It came at a high cost for businesses. It came at a high cost for school children, for parents, for workers. And so I think we would take a more holistic approach to decision-making if we had a do-over. And we would try to consider all sorts of benefits and consequences of our actions. And that may have led us to some different choices.
I have to ask about AI, because we're talking about AI in everything. Tell us a little bit about, from your perspective, what's the role, the realistic role, and I don't sort of mean in the sort of a hyping up new technology way, that AI can actually play in that do-over, in a new pandemic, now with AI on the scene. Yeah.
So in my field of health communication, I think folks are cautiously optimistic about its promise to develop accurate, actionable information for the public and for special populations. We're not there yet, but there are enough signs of promise that one can see a future where that's that's a legitimate value that it brings. One example to that, another colleague of mine, Ayo Olagoke, has found in her work that AI seems to be really good at generating analogies, ways of explaining complex scientific information in ways that are more accessible to people. So that's terrific. Like if we can get better ways of talking with different populations. So I also think that that AI is going to be really helpful in detecting misinformation or inaccurate or false claims that are spreading in communities in closer to real-time ways so that we can respond to them more quickly.
Let's end on hope. So you and I are talking, today's June of 25. It's a time of turbulence, a time of positively speaking, rethinking a lot of things and the way they've been done for the past 10 years. So in the moment, recognizing there are challenges, but looking through the challenges, tell me what gives you hope, what pushes you forward.
Hope comes comes from lots of different places, right? So like this is a bit of a personal anecdote, but one that I think you'll be able to relate to. So a month ago, for those who aren't in St. Louis, we had a big tornado, an F3 tornado, rip through the city, through my neighborhood, through your neighborhood, and did a lot of severe damage, and people are still recovering from that. But what I saw, outside my house was an almost immediate and really overwhelming kind of collective response of neighbors helping neighbors, people coming in from around the region with chainsaws and wheelbarrows and trucks and water and food, and then coming back the next day and doing it again, and coming back the day after that and doing it again. And it was oddly uplifting in this, amidst all this destruction, to just remember what we're capable of doing when we work together in communities. And so much of what public health does is try to align and mobilize communities to improve the living conditions and the health for everybody in that community. So I know we're capable of doing it because I've seen it firsthand just in the most recent weeks. And I think that's the sort of response that we're going to need to get through some of these challenging moments.
This conversation is like this to give me hope. Thank you, Matt. Thank you for what you do.